There are so many organizations that look for linguists to work in healthcare communication. I'm thinking of one in particular where I've just developed a research partnership with them so that they can engage in basic linguistic research. I mean, this is done in STEM all the time, but we now are at the stage where we have a company that's investing in us and in our students to provide an internship and potentially full-time staffing roles in healthcare communication basic research. So what can be done is that in the case of this company, which is in Vibe Labs, they collect answers to interviews that are taken over the phone, and they have an advanced set of listening technologies that search the voice for different emotions and to measure the types of emotions that are expressed in voice and intonation in response to different research questions. In addition to that, there are linguists who are doing discourse analysis on how people answer questions when they're, responding to an anonymized interviewer. So you can apply discourse analysis training to these types of jobs. You can apply your training in phonetics and phonology to this work, and you can have a real impact because you can discover the types of miscommunications that occur between healthcare providers and the people that they treat, or the caregivers who accompany the people whom they treat. So you can have a real effect in shedding light on these miscommunications and potentially play a role in developing strategies and protocols so that healthcare providers raise their awareness about things they might be missing, whether it's because of the linguistic or cultural affinities of the patients, and change how they work so that patients have more of a voice and more agency in how they seek healthcare. So there are a number of ways that you can be involved in healthcare communication, as Anna Marie said.
I remember one student of mine was hired by, and now it's an organization, a lot of their funding came from Big Pharma. And when she was first thinking about working at this organization, my acronym begins with B for business. You have to think about business. We live in a society where I'm not a fan of capitalism, but we are in a society where, you have to bring a business lens to kind of just about everything when you start to think about careers. So she'd kind of taken on this job with this idea like, I don't know, I want to have more social impact with my work. But one of the first jobs that she did, they sent her to do an ethnography in a doctor's waiting room. And she was sitting in there and listening to the conversations that patients would have and the kind of fear mongering that would happen in a doctor's waiting room, where patients would be talking about, like, don't let them give you this medicine and don't talk to them about this thing. And she realized that she could really help doctors to say, like, even if a doctor could just say, you may have heard, and just how much of a difference it could be to be a little bit reassuring around certain topics would make all the difference in a patient's health and well-being.
Yeah, and you know what, Anna Marie,